You're eating well, you're walking, your weight is fine. Yet someone who looks just like you ends up in the emergency room with chest pain. How does that happen? It's not about what you see in the mirror. It's about what's building inside your arteries while everything on the surface looks perfectly normal. I'm going to walk you through the physiology behind this paradox, showing you what happens inside the cardiovascular system when risk factors stack up silently, and at the end, I'll give you one practical rule that addresses the real problem. This is based on what research consistently shows about cardiovascular disease and the gaps in how we usually think about prevention. Most people don't realize this. Your heart and blood vessels operate on a completely different timeline than your appearance. You can have a flat stomach, run 3 miles without getting winded, and still have arteries that are quietly accumulating damage. That's because cardiovascular risk isn't just about calories or movement. It's about inflammation, insulin sensitivity, blood vessel flexibility, plaque stability, and how your body handles stress at the cellular level. These processes don't announce themselves with obvious symptoms until something goes wrong. Let me show you what's actually happening inside the body of someone who seems healthy but is walking toward trouble. Start with the arteries themselves. Think of them as highways with a smooth inner lining called the endothelium. When everything's working well, blood flows easily, and the vessel walls stay flexible. But when certain factors are present, even subtle ones, that lining gets damaged. Chronic low-grade inflammation is often the first step. It's not the kind of inflammation you feel, like a sore throat or a twisted ankle. It's a persistent, low-level immune response that can be triggered by things like poor sleep, high stress, insulin resistance, or even genetic factors you inherited. This type of inflammation causes the endothelium to become sticky, which allows LDL cholesterol particles to burrow into the artery wall. Once inside, they oxidize and trigger an immune response. Your body sends white blood cells to clean up the mess, but instead of solving the problem, those cells get stuck and form what's called plaque. This is where it gets tricky. Not all plaque is the same. Some plaque is stable, calcified, hard. It narrows the artery but stays in place. This is the kind that might show up on imaging tests. But the more dangerous type is soft plaque, which has a thin cap and a lipid-rich core. This kind can rupture suddenly, even if it's not blocking much of the artery. When it ruptures, your body treats it like an injury and forms a blood clot to seal the break. That clot can completely block the artery in seconds, cutting off blood flow to part of the heart. That's a heart attack. And it can happen in someone whose stress test came back normal just months earlier. So why don't standard checkups catch this? Because most routine tests are looking at the wrong things, or they're not sensitive enough. A basic lipid panel gives you total cholesterol, LDL, HDL, and triglycerides. Those numbers can look fine even when your LDL particles are small and dense, which makes them more likely to penetrate the artery wall. A resting EKG or even a stress test can come back clear because they're designed to detect blockages that are already significant, not the soft plaque that's waiting to rupture. Blood pressure might be in the normal range, but if it's creeping toward the higher end of normal over time, that constant pressure is wearing down your arteries. Your fasting glucose might be below the diabetes threshold, but if your insulin is elevated because your cells are becoming resistant, that's driving inflammation and vessel damage behind the scenes. Watch what happens during a typical day for someone who checks all the boxes on paper but is quietly at risk. They wake after 6 hours of sleep. Not terrible, but not enough for full cardiovascular recovery. During those lost hours, their body didn't lower cortisol or repair microdamage in the blood vessels. They eat a healthy breakfast, then sit at a desk for 4 hours straight. Even though they'll hit the gym later, those hours of inactivity cause endothelial dysfunction. Blood flow slows, the inner lining of the arteries becomes less responsive, and inflammatory markers tick up. Lunch is clean, balanced, no junk. But right after eating, they sit again for 3 hours. The spike in blood sugar and insulin doesn't clear as efficiently because there's no movement to help muscles pull glucose from the bloodstream. By late afternoon, they're stressed. That stress triggers cortisol release, raises heart rate, and stiffens the arteries temporarily. They hit the gym in the evening and do a solid 45-minute workout. That's genuinely helpful. It improves insulin sensitivity, lowers inflammation temporarily, and strengthens the heart. But then they go home, eat dinner, and sit on the couch for 3 more hours before bed. The prolonged sitting after eating keeps insulin elevated longer than it should be. They go to bed stressed, scroll on their phone for 20 minutes, and fall asleep around midnight. 6 hours later, the cycle repeats. Nothing in that day sounds extreme. Nothing screams danger. But the accumulation of small physiological insults, day after day, is what builds the problem. The arteries don't have a chance to fully recover. Inflammation stays elevated. Insulin resistance slowly gets worse. The endothelium becomes less flexible. Plaque deposits grow quietly in the vessel walls. And because the person feels fine, looks healthy, and their basic labs are okay, no one catches it until something ruptures. But there's something most people miss. Genetics load the gun, but lifestyle pulls the trigger. If you have a family history of heart disease, your arteries might be more prone to inflammation, or your body might process cholesterol less efficiently, or your blood might clot more easily. Those genetic tendencies don't guarantee a heart attack, but they do mean you have less room for error. A person without that genetic risk might get away with poor sleep and chronic sitting for years before seeing consequences. Someone with the genetic predisposition might see arterial damage accumulate much faster under the same conditions. That's why 2 people can live similar lives and have completely different outcomes. Take insulin resistance, for example, because this is one of the most underestimated drivers of cardiovascular risk. When your cells stop responding well to insulin, your pancreas has to produce more of it to get the same job done. High insulin levels promote fat storage around the organs, increase blood pressure, raise triglycerides, lower HDL, and directly damage the endothelium. It also makes your blood more likely to clot. You can have insulin resistance for years before your fasting glucose crosses into prediabetes or diabetes range. During that time, your arteries are getting damaged. And insulin resistance doesn't just come from eating too much sugar. It comes from chronic stress, poor sleep, sitting too much, and even from carrying excess visceral fat, which releases inflammatory molecules that interfere with insulin signaling. Consider inflammation more closely. Think of it as a slow fire inside your blood vessels. It's driven by things like oxidized LDL, high blood sugar, stress hormones, lack of sleep, and even infections or gut issues that keep your immune system on alert. This chronic inflammation causes the smooth muscle cells in your artery walls to proliferate and the endothelial cells to become dysfunctional. It makes the blood vessels stiffer, less able to dilate when you need more blood flow. It also destabilizes existing plaque, making it more likely to rupture. In some people, markers like high-sensitivity C-reactive protein or HSCRP can indicate this inflammation is present, but standard checkups don't always test for it. So you could be walking around with elevated inflammation, and no one would know. Blood pressure is another silent factor. Even readings in the normal range can still stress your arteries over time if they're consistently at the higher end. Blood pressure fluctuates based on stress, sleep, and activity. If it's borderline during a calm doctor's visit, it might spike higher during stressful moments. That repeated pressure on vessel walls accelerates damage. There's a trade-off people often overlook. Exercise is protective, no question. It improves endothelial function, lowers inflammation, helps manage insulin and blood sugar, and strengthens the heart. But exercise alone doesn't erase the damage from sitting 8 hours a day. Studies suggest that prolonged sitting is an independent risk factor, meaning even if you work out daily, the hours of inactivity still harm your metabolism and vascular function. The fix isn't to exercise harder. It's to break up the sitting. Stand, walk, stretch every 30 to 60 minutes. That keeps blood flowing, prevents insulin from staying elevated, and maintains endothelial responsiveness. Sleep is another factor that gets overlooked. When you don't sleep enough, your body stays in a mild state of stress. Cortisol doesn't drop the way it should. Growth hormone, which helps repair tissues including blood vessels, doesn't get released properly. Your autonomic nervous system stays tilted toward the sympathetic side, meaning your heart rate and blood pressure stay higher than they should. Over time, poor sleep is linked to hypertension, insulin resistance, weight gain around the midsection, and increased inflammation. People who consistently sleep fewer than 6 hours a night tend to have higher rates of cardiovascular events compared to those who sleep 7 to 8 hours, even when other risk factors are controlled for. Then there's stress itself. Acute stress isn't the problem. Your body is built to handle short bursts. The issue is chronic unresolved stress that keeps cortisol and adrenaline elevated day after day. These hormones raise blood sugar, promote abdominal fat storage, increase blood pressure, and make your blood more prone to clotting. Chronic stress also reduces heart rate variability, a marker of how well your autonomic nervous system adapts. Low heart rate variability is associated with higher cardiovascular risk. One detail most people ignore: oral health. Bacteria from gum disease can enter your bloodstream and contribute to arterial inflammation. Studies link periodontal disease to increased cardiovascular risk. It's not the primary cause, but it's another piece of the puzzle. Consider another factor. Alcohol in moderation has been associated with some cardiovascular benefits in certain populations, possibly because of effects on HDL and blood clotting. But heavy drinking or binge drinking clearly damages the heart and raises blood pressure. And even moderate drinking can be problematic in people with certain genetic variants or liver issues. This isn't a recommendation to drink. If you don't drink, don't start. The takeaway is that if you do drink, moderation matters. And for some people, avoiding alcohol entirely is the better choice. Cholesterol deserves a closer look. Standard lipid panels can be misleading. Your total cholesterol and LDL might look acceptable, but if your HDL is low or your triglycerides are high, that ratio matters. High triglycerides and low HDL often go hand in hand with insulin resistance and indicate that your body isn't managing fats well. Additionally, newer tests can measure LDL particle number and size. Small, dense LDL particles are more atherogenic, meaning they're more likely to cause plaque buildup than large, fluffy ones. Two people with the same LDL cholesterol level can have very different risk depending on their particle profile. Apolipoprotein B, or ApoB, is another marker that reflects the total number of atherogenic particles in your blood and tends to predict risk better than LDL alone. Most routine checkups don't measure this. If you only remember one thing from this, remember this: cardiovascular risk is built over time through the accumulation of small, invisible stresses on your vascular system. It's not about one bad meal or one missed workout. It's about patterns. Chronic inflammation, insulin resistance, poor sleep, prolonged sitting, unmanaged stress, and subtle genetic vulnerabilities all interact to damage the endothelium, promote plaque formation, and destabilize that plaque over years. The absence of symptoms doesn't mean the absence of risk. So here's the reset lever. Prioritize consistency in the basics that directly impact vascular health. 7 to 8 hours of sleep most nights to lower cortisol and repair vessel damage, breaking up long sitting periods even if you exercise regularly, managing stress through breathwork or time in nature, and getting the right lab work done. Not just total cholesterol, but markers like hsCRP, fasting insulin, or ApoB, if your doctor agrees. If you have a family history of heart disease, these details become critical. 2 practical alternatives. First, if sitting all day is unavoidable, set a timer to stand or walk for 2 minutes every half hour. That keeps blood flowing and prevents metabolic slowdown. Second, if stress is your main challenge, try a short daily practice that activates your parasympathetic nervous system. 5 minutes of slow breathing, a 10-minute walk without your phone, or lying down for a body scan before bed. If you're managing a diagnosed condition or have symptoms that concern you, consider talking with a healthcare provider who can assess your specific situation. The key is understanding that heart health isn't about looking a certain way. It's about how well your cardiovascular system is functioning day to day, behind the scenes, in ways you can't see or feel until something goes wrong. risk builds silently. Prevention is about addressing the real mechanisms, not just checking boxes on a generic wellness list. If this video gave you a new lens for thinking about cardiovascular health, leave a comment with the word invisible so I know this resonated. And if you want to see more content that goes beyond surface-level health advice and digs into what's actually happening inside your body, hit that subscribe button. Next time, we'll break down what happens to your metabolism when you skip breakfast for a month, hour by hour, and whether it actually helps or just adds stress to an already overloaded system. Thanks for watching.